In this video, I'm going to talk about a real pain in the bum, or more correctly, the tailbone. So this is Coccyx pain, otherwise known as Coccydynia. So I'm going to talk about what it is, what causes it, and how it's treated. I'm Stephen Bunting. I'm a specialist MSK physiotherapist and sonographer based in the UK. Welcome to my channel, where I discuss the common MSK conditions that affect everyday people and the evidence-based treatments that can help. Well, the coccyx usually consists of 4 small bones fused together at the very bottom of the spine, although occasionally there can be 3 or even 5 bones present. It connects to the sacrum above it, which in turns connects to the lowest lumbar vertebra, L5. It really serves no useful purpose anymore in humans and is essentially a vestigial remnant of an evolutionary tail. But it does act as a supporting structure when sat down, and multiple ligaments and tendons still attached to it. It's also supplied by lots of nerve endings, which is the main reason why it can be so painful when injured. So in the majority of cases, it's caused by direct trauma, typically a heavy fall, but it can also be caused by repetitively sitting on a hard surface, and as such, it's a known problem in cyclists. It's also common in pregnancy or after birth, and there's a higher risk of developing coccyx pain if you're very overweight or very underweight. It's also 5 times more common in women than in men. Well, we can divide the treatments up into the things you can do yourself and then the interventional treatments that a specialist can provide. So let's start with the self-help options, and the first thing you could use is some form of pressure relief cushion when sitting. Now that could just be a nice thick soft cushion, but you can also buy specific coccyx cushions, which are either a donut shaped cushion like this one or a C-shaped one like this one. And they can undoubtedly be very helpful, particularly when faced with a firm chair and the prospect of a few hours sat down, like in a restaurant or watching a sports game. The next thing that might be worth trying are the medications. Anti-inflammatories taken as a course for a few weeks can be worth a try, particularly if your coccyx pain has suddenly flared up or if it's constantly aching in the background, which might suggest an inflammatory type of pain. Just make sure that you check with a pharmacist if you can take them, as not everyone can take anti-inflammatories. And the other medication that people can find helpful are laxatives. Coccyx pain is enough of a problem on its own, but combined with constipation, it can feel much worse. So do avoid foods that can bung you up. And indeed, I would also avoid medications with codeine in, because they have the common side effect of causing constipation. Okay, so that's the main pain relieving treatments. The other thing worth trying are the exercises and stretches. Now these aren't going to be a quick fix, but are rather a slow burn, which can steadily improve symptoms as the weeks go by. And they can work really well in conjunction with those pain relieving treatments we discussed earlier. People with coccyx pain often have quite stiff lumbar spines and quite poor core stability, and so the exercises aim to address these particular issues. For stiffness, lumbar flexion exercises are often helpful. I'm going to show you 3 of the most useful ones. Firstly, lie on your back and pull both knees up towards your chest like this. Hold for a few seconds and repeat 5 to 10 times. You should feel a nice stretch in the lower back region. The second one is the sad cat, happy cat stretch, which is done in kneeling. You basically try and arch your back as high as possible and then do the opposite movement where you try and maximise the lumbar arch. Again, hold for a few seconds in each position and repeat 5 to 10 times. The last one can either be done in kneeling or in sitting. It basically involves trying to flex your spine fully forwards like this, and again hold and repeat the same as the other ones. For the stability exercises, I think one of the best ones for coccyx pain is the pelvic tilt. You can do this while sitting on your coccyx cushion. The exercise involves trying to maximise your lumbar curve like this, and then trying to do the opposite movement by flattening your back like this. Notice that my head stays in the same relative position throughout the exercise. I'm not swaying forwards or backwards like this. After you've done this a few times, try and find the mid position and then hold there while taking one foot off the floor. Keep this nice posture for 5 to 10 seconds and then repeat for the other foot. The other good stability exercise is the bridge. In its simplest form, you just lie on your back and lift your pelvis off the floor like this. Hold for 5 to 10 seconds and repeat 5 to 10 times. If that's too easy, then try taking one foot off the floor like this, and then swapping sides. And if that's too easy, then try doing the same exercise but with your hands crossed over your chest. Now there are lots of other back exercises you can do, but I've just tried to show you a couple of the basic ones that work well in my experience. If you want to push yourself a bit further, then Google exercises like the Superman pose, the plank, and the side plank. Also the bear pose, and the deep squat. The last thing to mention in the self-help section is your individual risk factors. So if you are that overweight, underfit person who sits for large parts of the day, then if you want to prevent this from becoming a chronic, long-standing problem, then you're going to need to lose weight, get fitter and sit less. It's really not rocket science. Okay, so now let's turn our attention to the interventional treatments. And the first thing that might be tried is a Coccyx cortisone injection. This is a fairly straightforward procedure, but it's usually done in a specialist setting. It usually works well, but there's often considerable variation with how long it lasts. It might work well and never return, which of course is the ideal outcome, but it might only work partially or temporarily. If it works partially, meaning it gets it partially better, usually by just improving the pain on one side of the coccyx but not the other side, then it can be worth repeating and trying to target the remaining painful area with a second injection. Now, if the injection works really well but wears off after about 6 months or so, then again it can be repeated, but I wouldn't advise that it's done time after time, year after year, as one of the side effects of repeated cortisone injections is that the skin can become thin over the needle site, which then carries a risk of the skin eventually breaking down and ulcerating, which is something you really don't want to happen in the area between your bum cheeks. Not pleasant. So if you're getting good but only short-lived results from cortisone injections, then an alternative treatment is something called radiofrequency ablation. This procedure involves placing a specialised needle under X-ray guidance into the region around the coccyx nerves, and then heating the tip up to a high temperature. This essentially destroys the sensory nerves that are responsible for transmitting the pain sensations. It might not be a permanent cure because the nerves have a tendency to grow back over time, but the procedure usually lasts at least 12 months and it can be repeated as it doesn't cause skin thinning like repeated cortisone injections can. Another treatment I will briefly mention is coccyx manipulation. This is only really indicated if the coccyx has become pushed into an abnormal position after a fall, so some form of imaging, usually MRI, is needed in order to determine the position of the coccyx. And if it has been angled inwards, then there might be the option of manipulating it back into its correct position. I'm aware of this being done by therapists in a clinic room setting, but I would recommend that it's done under general anaesthesia, under image guidance by a radiologist or an orthopaedic spinal consultant who will be much better equipped to deal with any complications that might arise. And the final treatment option that might be considered for those patients with chronic debilitating coccydynia, despite trying all of the other options, is surgery. Surgical removal of the coccyx is the final treatment resort option, although it has to be said that even this doesn't always work, as phantom coccyx pain can sometimes persist even after it's been removed. For patients who have to live with chronic coccyx pain and who haven't responded to the treatments we've discussed, or who have declined surgery, or maybe just not been medically suitable for surgery, then specialist pain clinics are usually the place where this condition is managed for the long term. Here, the emphasis is more on managing the problem rather than curing it, and various strategies can be used, including different specialist medications, cognitive behavioural therapy, TENS machines, epidural injections, and spinal cord stimulation. Okay, well that's all of the evidence-based treatments for coccyx pain. I hope you found the information of value, and if so, please consider subscribing to the channel and liking the video, as this really helps the channel to grow and gets the information in front of more people who might also benefit. So until the next video, thanks very much for watching, take care, and bye for now.